It's a new concept. Okay. See, earlier a patient used to come to a doctor, meet him, take a consultation, and take a prescription and go back. And until he visits the next time, he had no way of contacting. Basically, the internet, which has come in and makes you communicate with a person anywhere in the world, is the most important aspect that has come. Along with that, the practice of medicine has changed. Practice of medicine has changed quite widely. There are a lot of people in certain countries, where internet penetration is high. They sit in their offices, and the patient sits in their own houses and communicate with each other and get a prescription from it. Okay. Now, this is bound to come into prominence into India too. And the online consultation has started, and it's in the infant stages at this point of time, and it's just started and going to progress in the coming years. In psychiatric practice, online consultation is useful in many ways. Obviously, when you see a patient, the first thing that you do is observe the patient, the visual part of it. You hear the patient, you hear the tone of the patient, and you need to also examine the patients by touch. That is a physical examination. Now, on an online consultation, what happens is that the physical part of the consultation is no more possible. But the audio-visual part of the consultation is possible. Now, the audio part of the consultation was already existing to some extent because people telephone a doctor when in crisis. But in the conventional hospital practices, you don't really take the telephone all the time because you may be examining someone else, you may be dealing with someone else. Whereas a formalized audio-visual communication through telephones, through Skype, through internet, online, mails, and so on, you will be able to communicate with the doctor much more easily, irrespective of where you try to communicate from. So, a patient need not really come to the doctor. A patient can sit anywhere in the world and communicate. Okay. The doctor can actually examine the patient irrespective of where he is. Okay. So the distance has come down. As a result, the cost also has come down. So he doesn't have to travel, he doesn't have to wait for the doctor to see him. So the costs become much less. The cost is actually only on the communication part of it, which is far less than actually coming down and meeting the doctor. So, in psychiatry, it may not be mostly very appropriate or easy to kind of have the first consultation online or telephonically or basically using any audio-visual method, irrespective of whether it's Skype, telephone or mail. But after having seen the patient once, made a diagnosis, subsequent follow-ups can be managed with. But apart from this follow-ups, there are other ways of there are other benefits which are there. And what should I do? Should I come to meet you? Is there going to be any further benefit to meeting you? Okay, and he can decide from the doctor's answers before he actually comes to meet the doctor. Okay. That saves him a lot of cost. Okay. Secondly, a patient who is already getting treated somewhere, okay, he is getting particular kind of treatment. Very often when you go to a doctor for a treatment, the doctors have a limited amount of time, depending on the number of patients who are to be seen by. So he may not be able to explain everything that the patient wants to know because it takes time. And time is a hard commodity in at least populated countries. Okay. So there are so many doubts which a patient has. How long will it take to become better? Why is it not becoming better in 1 day or 2 days or 1 week and so on? So many doubts are there. So a patient can write and communicate and get all those clarifications from the doctor at a convenient time, because if the patient sends a mail or patient fixes up a off-time Skype or telephonic consultation, he or she will be able to ask many more questions, many more clarifications can be sought, a second opinion can be taken, and so on. So that is another advantage. There is also another advantage which is there, that is education. More, when you go in for a new form of treatment like psychiatric treatment, a lot of people do not know how it is done. Whether it is medicines, whether it is some form of counseling, whether it is something else, which makes the person all right. Okay, and it is beneficial for the patient's family and so on, to ask questions about, I have this problem, how do I deal with it? Okay, a person may be in some other country or some other state, and they can ask, I have this problem, and where do I take the person? Should I see a psychiatrist? Should I see a neurologist? Should I take medicines or should I go for counseling and so on? Okay, and that will give him a fair picture of how to actually manage the case without running around between different sources of management. Because before you actually meet a doctor, you find that you have a fair plan how to go about it. Okay. Those who can actually go on to the telephonic mode of consultation can use it as an emergency tool too. You may have been treating a patient, but there are times when there is an emergency and the patients are usually finding it difficult to kind of get the doctor at that time. One of the major advantages in online consultation is that there will be a file which is maintained on virtual space. So at any time, you don't have to store the file in different hospitals, and you can see him at any point of time, anywhere, even while he is actually traveling around. Because you can actually pick up this file and go through the file and see what's wrong with the patient and suggest to him what he needs. That is one. Second is, it gives certain degree of freedom to the doctor to kind of plan his work. He can move around. He need not be in a particular place, and he can see patients from anywhere. Whether it's a holiday or whether it's a work or a conference or whatever it is, he can actually manage. Thirdly, on a telephonic conversation with the patient, if you are actually taking telephonic consultation, patient can always call up at the time when there is a problem and describe the symptoms and describes the problems. So there is a real-time communication that will be there, and sometimes it is difficult to understand. For example, if there is epilepsy and so on, you suspect an epilepsy or a hysterical fit, which is basically a feature of unconsciousness, and then you need to know whether the patient is really had a neurological problem or a psychiatric problem, and calling up at the time when it is happening and describing it to the doctor about what is happening at that time would help him to diagnose much better. If there is an audio issue like Skype, communication, seeing what is happening at that time, and communicating simultaneously also would help him to get a more precise diagnosis. So those kind of things can happen too. So apart from the virtual file which is there, which you can refer back at any time, you can move around at any time. You can also get a real-time kind of communication with the patient without traveling to the place or the patient traveling to you. It again depends on the kind of practice which you are doing. Someone who is very young, who is entered practice, will want to expand his practice. And in that situation, if he has an office for practice, he has a limited kind of exposure to that office. And it takes years before he actually gets to be known, established, and gets a reasonably good practice. Now, by entering into telephonic consultation, he starts widening his practice immediately, and he is also communicating to the patient, look, you can access me at any time. By starting internet-based communication, he would be actually widening his area of consultation, because he need not stick to the area around his office. Because there are a lot of other people who will probably come from or consulting from far off places too. So the scope of consultation, actually the geographic area becomes wider. So now someone who is in the middle years of practice, it's a different situation altogether. Someone who has enough clients, is crowded, he does not really want to expand the numbers. He finds that the online consultation or telephonic consultation becomes useful for him to organize his consultation a little more precisely. He can have strict timing for his online consultation. He can have strict timing for his telephonic consultation. And the patient saves money, and the doctor saves time and running around and mobile. The time that he uses for running around between one office to the other office. He can also reduce the follow-up, because substantial number of follow-up can be done on either telephonic or mail-based communication. Still more can be done if someone uses Skype. Now that reduces cost to the patient, and many patients will take up on that. So the general feedback on those people who actually are internet savvy is that this is a cheaper, easier form of communicating to you. Because almost around 50 to 60% of the follow-up is actually only asking about simple things. Is it okay or not okay? And simple follow-up where the patient is actually getting any of the side effects which you expect him to get, or anything which is new, and whether actually the patient is recovering or not recovering at all. So the questions that you need to ask and know is very limited, and a person need not come all the way to meet the doctor, need not spend a lot of time to kind of see the doctor. So altogether it becomes more convenient for the doctor as well as the patient. So in the middle years, when you have already established a practice and you are in the thick of practice, this becomes quite useful. In the later years, like in my case, you would probably be seeing less number of patients. It's not really that you want to expand practice. You just want to see few patients, follow them up on a continuous basis rather than seeing them intermittently. So net-based practice or a telephonic practice in the beginning. I'm not using telephonic practice in the beginning, but a net-based practice, either Skype or mail-based practice, would give you the continuity of following up the patient, and gives me the freedom to kind of move around wherever I want. Whether I'm on a holiday, whether I'm somewhere else, some other country also, I can see my patients and follow them. Now, it gives a tremendous advantage for the patient because you're not at this point of time or this point of life stage, you're not really looking after acute patients. And you're trying to get the patients to be verified in quality of outcome. And subtle changes can be picked up faster by regular communication and the continuous follow-up. And a lot of times it's really not taxing on you to kind of be in an office and see patients from morning till evening. You can reduce the amount of time that you spend in the office. You can probably spend more time at home, more time on holidays, more time on other activities too. Apart from this, personally I find that it's quite interesting and quite necessary that there is a lot of education about psychiatric illnesses has to be given before a patient actually goes in for treatment as well as taking treatment. And I'm able to give those information to people when they contact me saying that, look, I have this problem. What would I do with this problem? Should I come and see you? Should I get treated here? Should I go to a neurologist? Should I go to a gastroenterologist? Should I come to a physician? Or should I go to a psychiatrist? And so on. Okay. So I will be able to kind of look at those symptoms, explain to them how to kind of go about it, what is expected, how long do you have to take medicines, and how to contact a doctor and so on. So if they actually mail me or communicate through a Skype interview. And also makes the patient feel that there is someone who is guiding you what to do. So I don't have to worry whether I've really got the right treatment at all. Okay. And that is an area which I think is very, at this stage of my practice, that will be very, very satisfying to do, because that is not available freely. Apart from that, a lot of people feel very anxious whether the treatment which they are getting is adequate and appropriate. So reassuring them, checking on those treatments and saying how to kind of follow it up, because a lot of times they do not expect psychiatric treatment to go on for a long period of time, and they would like to kind of stop it as soon as they become better and then get a relapse. Relapses can be grossly reduced if the instructions are given. So a second opinion or a clarification over the internet, over the Skype, helps them to kind of continue it, reduce the relapses, and thus reduce the disability caused by psychiatric illness. Psychiatric illness, after all, is a long-term treatment. It's not a short-term treatment. So they have to know a lot of information if someone has a psychiatric illness.